Checking in on the war between government and pharmacies in Ontario. We're going to talk about it on Goldhawk Live. Well, the war began when Health Minister Deb Matthews announced the government would drastically reduce the price of generic drugs in Ontario by eliminating what is known as professional allowances paid by drug companies to pharmacists. Then the war really began. Pharmacies fought back, big and small. They said the move would economically damage pharmacies, drive some of the smaller ones out of business, and result in fewer services available for customers. And so our question for you tonight, do you believe you will save money on prescription drugs? You can call right now anywhere in Ontario at 1-800-968-7836. You can send me an email or you can tweet me on Twitter. And my guest tonight in Toronto, Christine Elliott is here. She's Progressive Conservative MPP for Whitby-Oshawa, Deputy Leader of the Progressive Conservative Party of Ontario, and in fact the opposition health critic. Susan Eng is here as well. She is Vice President of Advocacy at CARP. And in our Mississauga studio, Ben Shenouda is here. He's a community pharmacist and the President and CEO of the Independent Pharmacists Association of Ontario. And then a little later on the line, we'll be joined by Deb Matthews, Liberal MPP for London North Centre, and the Ontario Minister of Health and Long-Term Care. Thank you, everybody, for coming in and talking about this, for helping us cover what has really become a war. Susan Eng, is that your interpretation of what's going on here?
Well, the stakes are high.
Yeah.
And it has gotten quite nasty, and CARP has been put in the middle of it. We're happy to support the changes. We think that the government could hurry up with some of its proposals for compensating pharmacists for services they do provide, and I think that's causing some of the angst. But unfortunately, seniors have also been put in the middle. And that means that people are worried, they're anxious, they're being told that the stores are going to close, that, that the money that the government saves is not going to do them any good. And yet we forget that the drugs that you and I pay for are also going to be less costly.
Well, that's the great hope, isn't it?
Well, of course, that's the whole point of the exercise.
Well, one would assume.
It's saving some $500 million every year, and that's a lot of money and a lot of new drugs they could be covering.
Christine Elliott, what's your view of this then?
Well, it has become a war, and I think it's most unfortunate, and I think it really stems back to the fact that the government didn't engage in real negotiations with the pharmacists. The pharmacists had come to the table months ago with a plan that would have lower drug prices. I don't think anyone would disagree that we all want to see that would have eliminated the professional allowances that were actually brought in by the Liberal government, and that would have resulted in a fair compromise for everyone, would have saved $1.3 billion over a 4-year period, but the government didn't listen.
Wasn't part of the problem that the professional fees, the pharmacists, one of them, were agreeing to having them eliminated for those under a drug plan, but not for everybody, and the Ontario government went full swath and said, no, we're doing this for everybody. Is that not part of the circumstance that you're talking about there? That's
right. It all goes back to Bill 102 several years ago, and some changes were made at that point. I think there were some that believed it didn't go far enough. And so I think the view of the pharmacists is that it was sort of a fait accompli from the beginning, that the government had a view of what they were going to do, and they really didn't listen to the effects it was going to have, not just on pharmacists, but on delivery of frontline health care.
All right. Let's talk to the health minister herself. She's on the line. Deb Matthews, do you feel like you are, in fact, in some kind of war here with the pharmacists?
I tell you, Dale, what I'm in is a war to get the price of drugs down. I mean, this is what this is all about. People in Ontario are paying far, far, far too much for generic drugs. And when I started to learn about how that worked, there was no question in my mind we had to take action.
What are these? Explain for us mere mortals who have a hard time understanding this. What exactly are these professional fees that are being paid? What's that all about?
So the generic companies are required to pay the pharmacies these allowances, rebates, whatever you want to call them, in exchange for stocking their drugs on the shelves. So it amounts to $750 million a year or thereabouts, and that's why the drug prices in Ontario are so much higher than they are in other places.
And I guess to hear Christine Elliott tell it, and in terms of what I've heard from other people as well, the pharmacists weren't expected that the professional allowances would be discontinued for all generic drug sales in Ontario. Is that your understanding of what they thought?
Well, we had over 9 months of conversations with pharmacy owners and pharmacists, and they did come forward with some proposals, but these were proposals that didn't impact their bottom line. I mean, their solution simply didn't achieve the goal to lower generic drugs for people of Ontario. And I'm not just talking about those on the Ontario Drug Benefit Plan.
No, but for everybody.
For everybody,
yeah.
Exactly. So I'm really disappointed that the Conservative Party has decided to ally themselves with Big Pharmacy. I think it's, I'm on the side of lower drug prices. I'm on the side of people with cancer, with diabetes, with all those conditions that require medication. We will be able to save people hundreds of dollars every year.
And save the Ontario government money as well on
Absolutely.
The drug plan side of it.
And what that means is we're going to be able to cover more drugs. The cost of our drug plan has gone up very rapidly, but as new drugs come on the market, we want to be able to fund those. We want to be able to include those in the formulary. We simply would not be able to do that unless we took some kind of action like the action we're proposing.
Now, just to complicate everything, I know that you were asked questions about what would happen if pharmacists bought the, got a hold of the drugs, the generic drugs more cheaply in Ontario and then sold them at higher prices in other provinces.
There are, many.
Is that a real concern of yours?
Well, it's a
possibility, I guess, eh?
And
yeah.
The health ministers across the country are watching what's happening in Ontario very closely. I wrote to them and asked them. I suggested that we include this topic at the next federal, provincial, territorial meeting in September, and I wanted to alert them to our changes.
Well, have you had any feedback from any of them yet? Are they thinking if it's a good idea in Ontario, it's a good idea in other provinces as well? I
can assure you that they are watching this very, very closely. All governments are faced with the same challenges in health care, and that is that the spending on health care is growing up at growing at a rate that simply is not sustainable. So if we want to protect our very precious universal single-payer health care system, we simply are going to have to make some decisions about where our money is spent. And if I have to choose between bringing down drug prices for people, expanding the number of drugs that are available, or continuing to put money into pharmacy, I know what side I'm on. I'm all about getting lower drug prices for people.
Now, in the minute I have left with you, there are some part of this announcement was giving back certain monies to pharmacists as well. Can you sum that up for us? Because in a few minutes we're going to be talking to the Independent Pharmacists Association of Ontario.
Absolutely. So what we're going to do is increase dispensing fees for all pharmacies. We're going to have special increases for those in rural communities because we really do value those pharmacies that are in rural communities. And most importantly, what we're going to do is kind of change how we pay pharmacists. We're going to pay them for delivering services like Meds Check, which is a service when you're on multiple medications. You can go in and have a pharmacist take a look. Our pharmacists are very highly trained, very highly skilled. We want them to work for better health. To
work together. Deb Matthews, thank you very much for joining us this evening. We're taking a break, coming back with your calls and more interviews. Don't go away. Well, we're trying to delve into this apparent war that's going on between the Ontario government and a lot of pharmacists in Ontario over these professional allowances and the fact that generic drug prices are going to drop quite a bit for the rest of us. If you'd like to join us in conversation anywhere in Ontario, here's the number to call, 1-800-968-7836. And we have in our Mississauga studio Ben Shenouda. He is a community pharmacist and the president and CEO of the Independent Pharmacists Association of Ontario. Ben Shenouda, you heard the health minister herself. How do you react to what she was saying this evening?
I would like to comment on a couple of things the minister have said. Pharmacists of Ontario are not against reduction of prices of generic. Actually, we are for that, and we are also supporting reduction on brand name, because brand name is more than 74% of the budget of the drug. We are not against elimination of professional allowance. The only thing we're asking, and the minister failed to mention this anywhere in the media or even on today's program, that the pharmacists in Ontario are paid the least dispensing fee in the whole country. She always come up with a question, why are we paying more prices for generic? The minister is the one responsible for pricing the medication. We have no power over this. It's her own responsibility. But in the meantime, she also failed to mention that she was taking about $750 million out of the system and giving us back $100 million.
So the money you're getting back and the dispensing fee won't be enough, even though you say you want a higher dispensing fee, that money coming back, the $100 million, is not going to replace the money that you're going to forego.
Exactly. It's like taking out of the system $3 and giving me $1 back. So how can you expect me to maintain the same quality and level of service I'm providing to Ontarians now? But
when you say Ben Shenouda, that you wanted the professional allowance, you're not against that. Was it the problem of professional allowances being discontinued for drugs under the drug plan and not being discontinued under drugs sold to everybody else? Is that the dividing line?
This one of the things, but we already discussed this with the discussion with the ministry, and we agreed about elimination of professional allowance. Actually, it was in our proposal that professional allowance would be eliminated.
Well, I guess she took you up on it.
Yeah, that's okay. We're not against elimination of professional allowance, but we need to be compensated fairly for the service we provide. You cannot take the money, ask us to provide the service, and not to pay us. How can we do that?
Okay. All right, let's go back to Susan then. Would you react to what Ben Shenouda is saying, Susan?
There are two really important things here. The point is that nobody wants to put pharmacists out of business. Certainly that's
we need pharmacists,
of course,
for crying out loud.
And that's been the outcry. But I think you have to make a huge distinction from the truly independent, single, smaller pharmacy who actually looks after their own business risk and the huge chains for whom the pharmacists actually don't get any of this money, the chain does. So when you talk about taking $750 million out of the system and only putting back $100 million, it could be that the people who actually provide these services and will in the future get paid for them on a billed basis, they will get a billing number just like doctors do, that they might actually cover
the pharmacists themselves you're talking about, not the companies.
That's right. Yeah. The pharmacists themselves might actually recoup all that they lost through this, or a good part of it. It's the people who don't intend ever to provide those consulting services that are going to lose out, because they will both lose the rebate and lose the opportunity to charge for those services.
And to my way of thinking, the money isn't necessarily being taken out of the system. It's given to the rest of us in savings on the price of generic drug prescriptions, isn't it? I mean, I don't consider that being taken out of the system as much as I think it's going to cost me less if I have a generic drug prescription.
May I comment on this?
Yeah, please, Ben, and then I'll go to Christine Elliott. Go ahead, please.
I will comment on your point that you think the system will hold itself, and this is not really taken out of the system. As we speak now, the cost to fill the prescription, and this is supported with 3 independent studies that have been done.
Okay.
Anywhere between $13.77 and $14.9. So yes, dollars to fill one prescription. The government now, as we speak, is paying us $7 to fill that. The professional allowance system was designed by the McGuinty government in 2006 with the purpose of filling in those $7 gap.
Without increasing the dispensing fee at the time, the professional allowances did that for them and for you.
Exactly. It was a free ride on the back of the generic companies.
All right.
So, and we said, okay, that's fine as long as we get the cost to fill the prescription. Now the government is taking away the $7 subsidy from the professional allowance. So the government, theoretically and practically, should pay us the $7, the gap.
Make up the whole difference. Make up the whole difference. Yeah.
Exactly. That's one thing. The other thing, coming to Susan's point about filling or getting the professional fee by doing more things, I agree with her that the professional fee is good, but it's not good enough. The professional fee is only $100 million. And we already have made studies, and we shared this with the ministry, that we will use 80 cents to get back $1 in professional service, which means that the $100 million will come back to pharmacy industry as $20 million. Yes, you may think theoretically it's a very nice idea to get the pharmacists to be paid because you have something against the pharmacies, but as a matter of fact, for the pharmacist to do this kind of job, he needs technology, and that's investment on the pharmacy side.
All right. Let me just do some math before I go to Christine Elliott. So $750 million is yanked back in professional allowances. $100 million comes back to you guys, but that doesn't make the dispensing fee high enough to cover the cost. So would it take all $750 million to do that?
No. It will
How much would it take?
It will take the fair compensation in our proposal. It will take something close to the $14.
Well, what would that mean in the total? The $750 million is what's at stake here in terms of professional allowance fees that are being yanked back. Some of that we want for savings when we buy drugs. How much of it would have to be spent in order to give you that $14 or so in dispensing fees? Have you guys done the math on that?
Let me just give you the right math here, Dale.
Okay.
It's not $750 million. It's actually $1.1 billion taking out of the industry.
Then it makes an even larger point.
Exactly, because this is a combination of the professional allowance plus the markup on the reduced generic medication.
Okay, I've got you. All right.
Yeah.
But again, you haven't answered my question about the $14 dispensing fee. If $100 million is coming back, including a little increase in the dispensing fee, how much would it cost to increase the dispensing fee to where you need it to be, $14?
You can make the math. The Ontario Drug Benefit is doing 100 million prescription a year. If you need to fit in a gap of 7, so you talk about 700 million.
Well, then that's
exactly a professional allowance.
Well, but so it goes out of so it becomes a paperwork, and it has nothing to do with the rest of us then.
It will be the saving. It will be a saving from 50%. It will be saving from 50% on the brand to 25%.
Okay, I think all right. Okay. Let me hear from Christine Elliott on that. Have you been writing down some of these numbers? Do you get this so far?
I do. I think the real problem here is the gap between the real cost of filling the prescription and what the pharmacists are currently being paid.
Which seems to be considerable.
It is considerable, and that's why the professional allowances were brought forward by the McGuinty government. This gap has been long outstanding. This isn't a new thing. The McGuinty government brought this forward as a way of addressing this somewhat, to allow the pharmacists to be able to continue to do some of these extra things. Everybody agrees this is a bad model. We shouldn't be operating on this. We should be increasing the dispensing fees over time. But we're trying to save money in the system and so on. The pharmacists came forward with a proposal that would have saved several $100 million a year, but they wanted to transition it over a few years.
Okay, so that's several $100 million. Say it's $200 or $300 million. Is that fair to say, Ben?
It's $1.3 billion over 4 years.
No, I'm talking about the... No, don't do that. Now, I know, but now you're confusing the issue.
You know,
Susan Ng, can you confuse the issue further? Or are you going to explain it
I can always
for
confuse.
All right.
But here's what happened. These rebates were being paid without a lot of reporting beforehand. And they were all over the map. They could have been 70% of the brand price or whatever, of the total price of the drug. And those amounts were being paid. The government came in and basically reduced the ones that they were going to build into the public pay drugs to 20%. They didn't say, here's 20%. They said, the 70% comes down to 20 across the board. They didn't say, here's 20%. And they kept it at 20 instead of 0 because of the argument that the pharmacists were going to provide services for that money. And now what they did was audit that to see if that indeed happened. They found there was a lot of abuse, that not everybody was providing services, and so they decided instead of assuming everybody's going to provide services, they were now going to actually pay for services actually rendered.
And track it, pay for the services that the...
And I think that if
you're nodding to that yourself,
and if they show that they spend, they provide serious services, we at CARP would advocate on behalf of fully funding them and funding them properly if the services are provided. The danger here is paying for services that are not provided.
Fair enough. Christine.
And nobody disagrees with the audit. We want to all make sure that the money is going to be
We got to track these things. It's a lot of money.
Absolutely. But at the end of the day, what it's going to mean, because these professional allowances were meant to assist the pharmacists in order to be able to provide those services. Now with the allowances being yanked, this means that there are going to be some services that are going to be lost, because you can't take $750 million out and pretend that there are not going to be any negative ramifications. There will be. There will be pharmacies that are going to close. There will be pharmacies that won't be able to provide free delivery service, that won't be able to waive co-payments for seniors like they used to provide a whole host of other services that particularly will hit seniors, that pharmacists won't be able to do because there is no way they can stay in business in order to be able to do that. And
at some of that. Are you agreeing with any of that or some of it?
I think accountability is a really important thing. We have to know where the money goes. I have no problem with that.
Yeah.
I also hear that the stores are threatening to close and cut services and take care, to make people pay for home delivery and so on. And they are holding seniors to ransom. And I object to that heavily. Their fight is with the province. If they don't like what the province is doing, they can have their high-paid lobbyists go and try to get a better deal. But right now, they're sending cards home with seniors saying, quickly call your MPP because you will lose our services. That is a threat, and I think that's improper.
Okay, let's go to the phone and see what people would like to tell us. Here's Jack now. He's calling from Ottawa. Jack, what do you think about all this? Do you believe you're going to save some money in the future on generic drug prescriptions? No?
No, I think I'm going to have to pay more. I think I'm going to have to pay more for dispensing fees. And also, I used to get free deliveries from the pharmacist, and now I believe I will have to pay at least $7 for the delivery, courtesy of the Liberal government of Ontario.
But won't the drug itself be cheaper?
No,
you don't think so?
No,
but
no.
Well,
the price is going to be set cheaper.
Yeah.
There's no choice. The government actually will set the price.
But it'll be offset by the additional cost that Jack's talking about.
These are retaliation measures by the drugstores. How much do they want to start charging for this kind of thing?
Ben Shenouda, go ahead, please.
This is not retaliation. This is the actual cost of delivering the service. Whether you get it from the $750 million professional allowance, you get it directly from the province of Ontario, or you get it from the patient. Just think about it. This is the cost of doing the service. What's happening here, that the province is downloading the cost to the patient under very nice banner like we reduce the prices.
Right.
What's covered in the cost of dispensing the prescription? Why does it cost $14?
Because it does involve human being expertise like pharmacists, technicians, verification, system, monitoring of drug interaction, monitoring of the dose or the medication in association with the current disease status.
So it's mainly staffing. Is that what it is?
Beg your pardon?
It's mainly staffing, I say.
Yes.
Yeah.
It's staffing and the expertise, because you cannot.
Well,
Dale.
Yeah, Jack, go ahead. You wanted to add something.
If I could, I'm on Ontario Disability Support Program. And I get free delivery right now.
Yeah.
But under the new system, under the McGinty system, I will have to pay $7 per delivery.
You've been told that, I'm assuming, by your pharmacist, right?
Yes.
Yeah.
Yeah.
Well, that's hardly of much benefit. Then you're going to have to scrape the money up from somewhere.
Well, it depends. If the drug is $100 and right now, and you save 50%, you save $50 on it. That's net. Now, all the other, if the druggists want to start charging for delivery,
yeah, but the drug plan will pay for the cheaper drug. Jack's still left with the $7.
Well, this is so, and
you
the
know what I mean?
Is,
the
why
government's not going to pay for that.
Why do the pharmacists say you have to keep our profit margins? If you look at some of the big chain published financial statements, their profits in the hundreds of millions of dollars, and a good lot of that are these professional allowances. Now, why are we obliged to keep that up for them? I am entirely sympathetic with the single proprietor pharmacists who can show their pro forma balance sheets and say, well, this is what we need to live and to stay in operation.
Ben, you wanted to make a point.
Yes, why it is always when we say the truth, the government or Susan go back to the big chain. I'm an independent store. What about me? What about thousands of independent stores in the province?
Well, there's really two different pictures, right?
I did really try to make that distinction.
Don't I have the right to make decent profit? Don't I have the right to put food at the table?
Sure.
Don't I have the right to send my children to university?
Yes.
What's wrong with that?
Okay, listen, Ben Shenouda, everyone,
No,
we're going to take a pause here.
Dale.
We'll come back and talk about the smaller independent pharmacists right after this break. Don't go away. Well, we're working our way through the war between the government and pharmacists in Ontario, hoping that truth is not the first casualty of that war. And Ben Shenouda, I want to come back to you as the president of the Independent Pharmacists Association in Ontario to tell us, and this was just happened before the break, the differences between the small pharmacies that you represent and the big monster chains.
The major difference is the small pharmacy dependent more on prescription. So out of my revenue or my colleagues' independent pharmacies' revenue, is more than 80% of our revenue comes from prescription. If you compare this to the chain drug stores, it's something like 45% of the revenue comes from prescription.
And the rest is chips and whatever.
Yeah, the other part of the store.
Yeah.
For me, if this regulation goes through, I will be very badly hit on my revenue side. I may be able to survive a year and a half, but I will basically be forced to reduce my hours, lay off my staff, and I have to think very seriously of level of service I'm doing for my patients as well, if I would like to stay in business.
Well, percentage-wise, how much of your total revenue then, restate this for us, how much is your revenue going to decrease by? As a percentage, how much of a percentage of your revenue are you going to lose?
I have more than 50% of my prescriptions coming from Ontario Drug Benefit. So if the Ontario go ahead with this plan, you can say on the night of the May 15th, when I close my store, my inventory will worth, let's say, $100,000.
Yeah.
If I open in the morning, my inventory automatically went down to about $50,000 or $55,000. So without doing anything, only between night, I will lose something like $45,000 on my inventory. And
your argument is that's certainly not sustainable.
It is not sustainable for a small business like myself or like the 1,500 independent stores in Ontario.
Okay, let's go to the phones to get some more voices involved here. Here's Ian calling from Toronto. Ian, what do you think about this? Do you believe people will actually save money in some cases on generic drug prescriptions?
I'm persuaded by what I've heard that the government's plans to make changes will reduce the price of generic drugs and will increase access. I work with a lot of frontline healthcare workers, so folks who work in emergency rooms of hospitals, who work on hospital wards and who work in clinics, nurses and physiotherapists and so on. And I know that they're very supportive of this change. They recognize that the change is important for two reasons. One, because it will bring down the price of generics by 50%. and that means that the healthcare system here in Ontario will be that much more sustainable as people get older. And secondly, the current system for paying pharmacists allows generic drug companies to provide kickbacks to pharmacists in a way that is not transparent and doesn't necessarily protect the interests of patients. And a lot of that money isn't going directly into care. We can tell that. The day that these changes were announced, the share price of Shoppers Drug Mart fell by 10%, and the company acknowledged to its shareholders that it would take a hit in its profits, because that's where a lot of this $750 million was going.
But you share concerns that some people have, including one of our guests, that in the case of some smaller pharmacies who depend a great deal on the prescription trade in their little stores, might be in danger of going out of business.
It's clearly vitally important that the government follow through on its promise, and what it has promised to do is to pay those pharmacists directly for providing those services. That's a much more transparent way, and it links those payments to services that are reaching Ontarians. And folks are a lot more comfortable with that, especially folks who work in healthcare are much more comfortable seeing that happen than allowing the drug companies to work out a deal with the big pharmacy chains and then hand the bill to taxpayers. That doesn't seem like a good way of organizing things at all. And I would also just like to put a question to one of your panelists. We've heard a lot about how this might affect elderly people in this province. Christine Elliott thinks it might affect them negatively in some ways. But CARP clearly speaks for seniors in this province, so I wanted to put the question to Susan Eng. At the end of the day, do you think the government is doing the right thing here? Do you think this is a positive change? Do you think seniors will be better off and that their health care will improve as a result of this change?
Ian, thank you very much for your question. Thanks for your call. Susan Eng.
Thank you for the question. Not only do I think that this will help seniors here in the province of Ontario, whose drugs are in fact covered by the province, but also our members do. As you might know, we have 350,000 members across the country, and we poll them about this very thing. And usually we get 3,000 to 5,000 people who answer our polls, and this time we got 2,000 here in Ontario answering the poll, which is an awful lot, exactly the demographic we're talking about. And normally we get 50, 60, 70% support. This time it was 91% support for all the points that I've made tonight. You know, the fact that the costs will go down, they disagree with the rebates, they think it's fair to pay the pharmacists what they provide in terms of services, and they think that the pharmacy chains are being disingenuous.
Okay, let me just go back on one point. We talked about $100 million, and I believe Deb Matthews used this figure and has been using it right along. $100 million, I guess that's the top line of the budget, going back to pharmacists for services. So then maybe part of the problem here, and Ben Shenouda might agree with this, that $100 million figure's got to go up. Would that not help protect the interests of seniors as well as offer some reasonable return, especially for small pharmacists? Ben Shenouda.
It has to go up. For sure has to go up. And I would like to comment on Susan about the support of seniors. Yesterday there was at Queen's Park. It was the Alliance of Seniors representing 200,000 seniors excuse me, in the province of Ontario. And they are against this reform and against the proposed. So there is a split of the opinion here. Does not mean that Susan is representing all seniors in Ontario, but we have.
What is this? All right, let me stop there because Susan is shaking her head. Is this another seniors group?
I've never heard of them, but that doesn't mean they don't exist.
No, it doesn't.
But I know for a fact that the 2,000 or 3,000 people who responded to our survey exist, and they are our own members. So those are the only people I can absolutely speak for. But they are representative, and they are live, breathing people. This other group, I did ask at the ministry and so on as to who they are, and no one seems to know. But I know that they have a PR firm working for them, so I'm sure that they can disclose.
The seniors group has a.
Apparently so. So they can certainly disclose who they are, but I don't know of them. And
I'm surprised to hear that. I'm surprised to hear that because this association, the Alliance of Seniors, represent 20 organization and the big list of association, and there was on Queen Park yesterday, but it doesn't matter.
Yeah, let's not battle over. I mean, that's not going to get us anywhere because everybody's going to have their opinions on that.
Yeah, the fact is, we are not against reduction of prices of medication. We're not against elimination of professional allowance. I think the key question here, everybody is avoiding to answer, is the government willing to pay the real cost of filling the prescription? If the government is willing to do it, I personally don't care whether it's through PA or through the government. I prefer direct payment from the government. But do not ask me to eliminate the professional allowance completely, and then I have to work and train and invest in IT to get the $100 million back.
Okay, all right. Let me go quickly to Christine Elliott, then we got to get some of these phone calls on. A lot of people want to have their say about this.
Well, I think that Ben hit the nail on the head. The real issue is the gap in funding here, and the fact is this government just doesn't have the money to be able to do that, to address it in the way that it really should be addressed. But there are no simple solutions in healthcare, and I think that that's part of the problem here, is the government is trying to say, look, we're going to save you $1 billion and we're going to be able to buy better drugs and so on. There are no simple solutions in healthcare anymore, and you can't go and pretend that there aren't going to be consequences of doing this. So what you may end up doing on one end in saving some of the costs and the actual drugs themselves, you may well lose at the other end when community pharmacies have to close and people start flooding to emergency departments and put extra pressure on family physicians to answer all of the questions that currently pharmacists are adding. And I don't think the government has added that part into the equation. In my view, it's a false economy, what they're talking about with this proposal.
To the phones, here's Fareed calling from Stouffville. Fareed, what's your take on this? What would you like to tell us this evening?
Okay, thank you for having me on, Mr. Goldhawk. I just want to back up a minute and let's take a look at the bigger picture. First of all, Mrs. Ng has not told her seniors group that come May 15th, when this bill passes, there will be absolutely no savings to seniors. Quite the contrary. They will continue to pay their co-pays and deductibles, and over the next 6 months to a year, they're going to begin to be paying for services that normally were free. So what Mrs. Ng needs to do is go back to her seniors and begin to really study this problem, and they need to understand that they're going to now be paying out of pocket for things that they normally weren't.
Okay,
now,
let me get her to answer that first off. All right, thank you, Fareed. Susan?
You know, there's no absolute determination that they must pay for these additional payments for services like delivery and so on. This is what the drugstores have decided to do. All we're saying is that the proposals don't necessarily make sure that you have to pay these things.
But if you're a senior over 60, I mean, he's got a point. If you're a senior over 65, you know, these drugs, if they're on the formulary, are paid for, and you pay that one-time fee per year, and that won't change, right?
But the point that he's missing, and everybody seems to completely ignore constantly, is that there are services, professional services, and home delivery may not qualify as a professional service, but
we don't know that yet, do we? We don't know that detail?
We don't know, and it's up to the pharmacists who want to make their case that these are necessary and critical services that they need to be paid for, that they should advocate for that and say, pay me for those and pay me enough for those. But instead, they're talking about, well, we're going to hold seniors to ransom. So I think that it's very perfectly fair for us to say, look, if you need this money to carry out your business and have a decent profit to raise your family, make your case on that.
Well, we don't want any of these moves to put anybody out of business. That doesn't serve anybody, does it? Yeah. Fareed, thank you very much.
I need to make another point.
No, Fareed, I'm sorry. I've got too many people here who also want to make points. Thanks for your call. Here's Rajiv calling from Toronto. Rajiv, what's your point? What would you like to add to the conversation?
Hi, Mr. Goldhawk. Thanks for having me.
Sure.
What Deb Matthews and the Minister of Health has proposed is to take $3 out of pharmacy and then hand it back as a carrot, saying, here's $1 back if you do meds checks. Now, what they have forgotten is that the $3 was right now paying for pharmacists to do the things they do on a daily basis, free of cost for the general public of Ontario. A young mother comes in with a little child crying his head off, oh, my child's got a earache. The pharmacist will walk out of his counter, spend 15 minutes talking to this mother, help her with a year medication, and off she goes. She goes home.
And under the new regime, that won't happen?
Well, there's no funding. So basically, costs to accommodate the lower costs, pharmacists are going to have to lay off technicians, function with reduced hours. When this kind of question comes to you and you've got a lineup of people trying to fill a prescription, guess what? The prescription's going to take priority. That lady might have to wait an hour or an hour to just get the pharmacist's attention to ask a question.
I guess you're a pharmacist, are you, Rajiv?
Yes, I am an independent pharmacist. I own 4 drugstores. And I know the reality and the dynamics of this healthcare profession for the last 15 years. Susan Eng has answered some questions, but truly she does not understand the day-to-day dynamics and the workings of the healthcare system as relevant to pharmacy. Now, this young mother is going to be forced to go to the emergency. So will thousands of people every day. Or they're going to go to a walk-in clinic. Now,
thousands of people are going to be forced to go to emergency rooms because of this?
To walk in, yes, absolutely, or to walk-in clinics.
All right.
Even now, one person that sees a doctor at the walk-in clinic the doctor is going to get paid $32. Now, where is the cost savings? This is what Christine Elliott was just saying. The ramifications of this cutback has not been examined properly by this government. They are going to pay somewhere else the same costs that they're taking away from the independent pharmacists.
Rajiv, thank you.
Pharmacists will be going out of business.
I got a lot of people here I want to get on here. A quick word from you, then I'm going back.
The proposal, albeit not in hard ink yet, says very clearly that when the pharmacist provides that service that he describes, that pharmacist will be paid for that service.
So if he spent time with the young mother, he'd be paid.
He can charge for it.
But we don't know those details
yet,
do we?
Well, that's true. That's valid, and that's a valid point. But if the point is that they will be charged, they will be paid.
All right. Ben Shenouda saying it's not true. What's not true, Ben Shenouda?
That's not true that that we know this for sure. The government have put another $50 million, and they said that this is for MedCheck, have been consumed $12.5 million. They can put whatever number they want on the table on piece of paper. The pharmacy will not be able to get it because of the practicality and day-to-day workload we have in the pharmacy. It's very nice to come and say, I will give you $100 million, but they know for sure that we will not even touch 20 million out of it.
Christine Elliott. Let me hear from Christine Elliott.
There's still so many unknowns here, so many variables that need to be worked out.
The devil is in the details, and we don't know the details. Isn't that really something we can all agree on?
The government needs to go back and have a real consultation with the pharmacists so they understand the full ramifications.
But not in the middle of the war, I guess, eh?
Well, they're not willing to. The government is only willing to come back and talk about the $100 million allowance and how that will be doled out in rural and underserviced areas. We need to take another look at the big picture and what's going on here and get a solution that suits everyone.
All right, thank you, Rajiv. Here is Sheila calling from Toronto. Sheila, what do you think about all of this? What's your opinion?
Hello, I'm not a pharmacist. Aren't we hearing such a lot from pharmacists?
Well, you're not, so go ahead.
I'm not. I like what Susan Eng has been saying. I think that the very aggressive reaction taken by the pharmacists and the pharmacist chain diminishes their professional reputation. They encounter the situation every day of ordinary Ontarians coming to their counters with a prescription, asking how much it will cost, and walking away because they do not have enough cash to fill that prescription. And so this huge focus on, are the pharmacists going to do all right about it, is one aspect. But let's not forget that there are people who need medications, and that certainly does have implications for, for our emergency rooms and for the rest of our health service, who simply, they don't have any kind of coverage, and they simply have no way of paying the high costs of some prescriptions. So this measure will put a lot of medications within their reach. And I'm so disappointed that these pharmacists who encounter people day after day are responding to this without acknowledging that.
Okay, let's go to Ben Shenouda about that. Ben, how do you react to what Sheila's saying?
I think Sheila is very emotional about the government. I don't believe that Sheila have really...
She's very emotional about pharmacists by the sounds of it to me.
I don't think so.
Well, that's what it sounded like to me.
Spend 2 hours behind the counter, Sheila, and you will understand why pharmacists are so outraged. Because we see, as you said, that I have patients coming to me and saying, price this prescription, and they walk away. In the meantime, I have patients on the phone. They are puzzled about taking their medication, and I help them. If I don't have the time or the ability to help them, they'll be lost. I have patient coming to my counter crying because her husband is at bed and she cannot have an appointment with the doctor, and she's crying and asks me to help. And then I call the patient, I try to triage the patient and send them to the hospital, send them to the doctor, or do something to help him. This is the role of pharmacists. The role of pharmacists is not counting pills and shuffle it in a bag and give it to you.
Yeah, but that's part of it.
This is certainly part of it. This is the start of it.
Yeah.
But the main care we provide is much more complicated than that.
All right.
And if the government will take the money and blind Ontarians about the prices, what about the service? Can Sheila get the medication and nobody talk about the medication? You just put it in a bag and here you go?
All right, let me get some more calls on. Here's Ray calling from Pickering. Ray, what do you think about this? Ray, go ahead, please.
Hi, I've got a question for Ben.
Yeah.
The number of patients that actually come in that only pay cash prescriptions, what would you say that would be? Because I have a drug plan, my family has a drug plan, my parents are seniors. How many people actually come in and just pay cash?
Just pay out of their own pocket for drugs.
Yeah.
What about that, Ben?
About 5% to 7% of the total number of prescriptions of any pharmacy.
So really, 5 to 7% of Ontarians are actually going to save money on the cost of a generic, because everybody else has either got some sort of a drug plan or is on Ontario Drug Benefit. So really, the big savings is going to be the insurance companies, because they're going to have a huge savings on the generic price. Obviously the government, because they're going to have a huge saving on the generic price. But ordinary consumers who just pay cash, 5 to 7% of the people are actually going to have a savings. So I guess my question is that if the government is turning around and cutting the price of generics, then who is actually going to benefit from this? It seems to me it's going to be the government, because in the end...
And insurance companies.
And insurance companies.
Yeah.
And again, it's going to be the industry. So it's going to be GM, Ford, Chrysler, whoever's got a hand in the government's pocket saying, how are you going to help us out?
Meantime, the clients...
We're going to move south of the border.
Meantime, the clients may have to pay an extra delivery charge.
Exactly. And then you're going to have your first caller who sounded like he was in poor health. And now all of a sudden, his $2 copay is not going to change. Is the government changing the $2 copay or the $6 copay? They're not. So now how is the pharmacy going to pay somebody to get in a car and drive to this gentleman's house and give him his prescription for free? The price of gas is $1 a liter.
Yeah, that's right.
It's not going to be affordable.
Thanks. Let me get some reaction to what you're saying.
Well,
first
of all,
from Susan.
The money that is saved, all right, the government's money, the part that the government pays for, that they have committed to keeping that money in the drugs budget. So to cover new drugs, to pay for these counseling services and so on. And I still don't
it may be more than $100 million?
Well, it could be, and I think we could advocate for more. But somehow I don't understand why people keep saying I'm doing it and somehow somebody else is going to pay for it. I don't understand why they don't believe the government is going to pay them for their services. But that aside from that, then the next point is that the drug plans that are privately put out are often self-insurers. It means that those plans too can be better negotiated. They will cover more drugs. You can get better terms, and the rest of us who pay for it ourselves will also benefit. So actually, the reduction in generic drug prices helps everybody.
Although in the cases that were cited by Ray, if your prescription's already paid for by your insurance company or paid for by the Ontario government under the drug plan, you don't personally save a buck on that.
No, but we all do. We have to get away from the idea that it's somebody else's money. This is all our own money.
We know where it came from originally,
These are tax dollars that we're trying to get value.
In other words, it's more money to benefit the whole system that's being saved.
Well, of course it does. That's the point.
Okay. Christine Elliott.
Well, it is a small group of people who will actually directly benefit, but again, it's a false economy, because you're going to see all of these other things that are going to happen as a result of this. I know that a lot of the hospital pharmacists are very concerned. They can see this coming. They know there's going to be a flood into the emergency room of people. This is the counseling that pharmacists do on a daily basis, and they're not looking to be greedy. A lot of people they're being vilified, quite frankly, by this government with some of the things that the government said about them and the minister.
But, well, that's why we call it a war, because it's getting pretty heated, isn't it?
But they're a small business after all, and the Canadian Federation of Independent Business has come out in support of the pharmacist position because they're entitled. They're well-trained professionals.
Let me try to get one last quick call on before the break. Here's Gabrielle calling from Ottawa. Gabrielle, what's your point you'd like to make about all of this?
Thank you for, that's kind of a great segue actually to what I was going to talk about. There are actually savings to the healthcare system to have pharmacists working. I'm a hospital pharmacist, but I also moonlight in community often. And a lot of times I actually see men who are sweating profusely, going to buy Rolaids, and I actually go to them and say, excuse me, you really should be going to an emergency room because they may be having an MI.
Yeah.
Sorry, heart attack.
Myocardial infarction.
Yeah, exactly.
Yes. Okay.
So a lot of times, actually, when a patient comes to the pharmacy, we actually can diagnose them, or not diagnose them, but refer them to the hospital a lot faster than they may have gone, saving taxpayer dollars because they get to the hospital, they're, you know, not on life support or you know, in a really bad situation when they get there. And there's also something else that I think people kind of miss. I don't know how often people go to the pharmacy and the pharmacist actually does not sell them anything. They counsel them and they tell them, you know what, you actually should be doing this, this, and this.
Yeah.
And for all that time that we spend, maybe 15 minutes with that patient and tell them, you know what, don't waste your money on buying this. It actually doesn't work. Go home, drink water, get lots of sleep.
I hope there isn't much in your supply that doesn't work. We like to hear about them working.
Well, no, but you know, when it comes to pharmaceuticals, there is mass marketing, especially when it comes to over-the-counter products, right? So a lot of times, the pharmacist is the person who tells them, you know what, this is probably not what you need. For that patient and that 15 minutes that we spent with them, we get nothing. Yeah. Right. Another thing too, that's my last point. A lot of times when people go to pharmacies, your pharmacist will actually tell you, by the way, if you get this for like 3 months at a time, you'll save 2 dispensing fees. So we actually kind of undercut ourselves, and a lot of people don't realize that as well. And to Susan Eng's point about the seniors holding seniors at ransom, it's not that at all. Like, I don't know any person who would want, especially if you go into pharmacy, your focus is patient care.
You wouldn't want to do that. That wouldn't be your focus.
Absolutely not. And it's only because seniors are the people who use those services more.
Thank you very much for that. Thank you. We have to take a quick break. We're coming back. Don't go away. Well, I can't say we found any peace or any end to the war, but we certainly had a fairly good time talking about it. I hope some of you understand it a little better now. I've got 2 minutes left. I need a final thought or two from each one of you. First from you, Ben Shenouda.
I would like to say to the public of Ontario that pharmacists are not against reduction of prices, and we are not against elimination of professional allowance. Our main ask is to be fairly paid for the service we provide. If you do not believe us, look what happened in Ireland. The minister there did exactly the same thing proposed here 6 months ago, and the level of service have been diminished in Ireland. 16,000 pharmacy jobs have been laid off. Delivery have been cancelled. Blister pack have been cancelled.
All right. Thank you very much for that, Ben. Your final thoughts for this evening, Christine Elliott.
Well, from my perspective as a member of the official opposition, I hope that the government will come back to the table and sit down and have a real discussion with the pharmacists about the ramifications of the changes they're proposing and develop a solution that's in the best interest of better health care for all Ontarians.
We don't really have many of the details yet, do we?
No, we don't.
I say that. I ask that of you. No. I ask that of you too, Susan Eng. We don't, do we?
You know, I hear what the government has to say. I chose to believe it. Some people seem to consistently have willful deafness and don't believe parts of it they don't like.
We've been taught from time to time not to believe the government,
and that's fair comment. That's fair comment. So my premise is this. CARP does not want to put independent pharmacists out of business. We are focused on reducing drug prices for everybody, including seniors. Now, we believe that this proposal will work, and it's important to separate out the plight of the independent pharmacists and the huge chains. It's an entirely different situation, and this PR program they're engaging in has done nothing to bring credit to the
What's going to end the war? Somebody's going to have to say, okay, let's talk, right, at some point.
I think we have to see some numbers. We're going to see some pro formas from some of the independent pharmacists.
Some good details everybody can buy into and study, and maybe then there'll be a little bit of peace in this. Thank you all very much for coming in. Thank you, all the callers. We have a special town hall program tomorrow night, talking about the G20. What's it going to do to life in downtown Toronto? Join us for that 2-hour show tomorrow night here in Toronto.